All right, everyone, welcome to the Digital Health Day at the Capitol, sponsored by, put on by the TAG Digital Health team, as well as the HIMSS, Georgia HIMSS. Obviously, we would have loved to have been in person for this particular event, but unfortunately, due to extenuating circumstances, we're virtual only today. Today's topic is going to be about supply of essential healthcare workers. We're going to be talking through our concerns around, healthcare resourcing, workforce, and really development of that within Georgia. We'd like to kick off first by thanking all of our folks that helped participate in putting the event together. Seppi from Georgia HIMSS, Pat Williams from TAG Digital Health, Chris Cooney from Georgia HIMSS, Chris Carabinos from TAG, Michelle Madison from TAG, Paula from TAG, and Kimley from Georgia HIMSS as well. Obviously, without the support and volunteer work that they do in order to be able to help put this together, we would not be able to put this on. So again, can't thank this team enough. Lots of meetings, lots of time put into putting this together and getting this into where we are today. So I'm going to turn it over to kick us off with Chris Carabinos. He's going to talk through our digital health ecosystem platform. So with that, take it away, Chris.
Thank you, Brian, and thank you all for attending as well. Just 1 second. I think most of you probably know who TAG Digital Health is. There's always a few people who are guests of Georgia HIMSS may not be as familiar with us. And so TAG, as you know, is one of the largest statewide technology associations in the country with 30,000 members. The Digital Health Society is one of 23 different societies, and we're one of the largest, one of the most active. And we do that with events, with advocacy like today's event, Digital Health Day at the Capitol. We also do market research and a number of other things. Periodically, we publish a report called the Digital Health Ecosystem. We last published it 2 years ago in early 2020, right before COVID. And at that time, we got several requests literally the week after we published the report. Hey, my company's missing. When can you add me? And with a paper-based report or PDF, that's not just something we do very often. So we made the decision then to go ahead and digitize it and put it online. After all, we are a technology association. So we discussed it for a long time. We worked to get TAG's approval. We actually got one of our board member companies, Tele-Nephrology Systems, to actually create it and build it. And in fact, Tele-Nephrology is so generous that they are actually donating this platform to TAG for use with other societies. I'll mention something about more that in a minute. But what I want to do here is share with you screenshots from 3 pages to give you an idea of what this thing's about. And it's great having David Hartnett here with us. You guys may remember 2013 to 2017, the MAC, Metro Atlantic Chamber, State Economic Development in Georgia. I see EJ on the line here. Georgia State, Kennesaw State, several other organizations banded together to create a map where we branded Atlanta or Georgia as the health IT capital of the country because we had so many companies. Well, there was such a big lift and people changed that I think we quit publishing that in early 2017, but we've always loved that data. And so what this is a reincarnation of that in a different way. It is online. You don't have to be a TAG member to utilize it. It actually includes a lot more data and a lot more companies and layers. So if you want to look at the core digital health companies, you can see the 225 companies that are there. Or if you want to look at the law firms and the CPA firms and the other people that are companies that service that ecosystem, you'll be able to search on those. And so it also includes incubators, investors, top 20 hospital systems in the States. And as we continue to build it out, it'll include more. So basically what you see here is you'll see 3 key components. You'll be able to search, browse the ecosystem. You'll be able to look at the ecosystem by the numbers, and also eventually, this is showing here now, the digital health events. We'll deactivate it when we launch it until we actually build that out. But it will include digital health events from the state of Georgia, not just for TAG Digital Health, but Georgia HIMSS, Georgia Bio, Health South Connect, all the organizations that we can come up with. And then also you'll see up here, there will be an opportunity for companies to manage their own company profiles. In a way, if you're not in here, you can actually submit your company for inclusion. You can either search. In fact, I'm just going to go ahead and show you the next page. This is the search page. You can actually search by a specific company. And or if you want to search by Columbus, tell me all the digital health companies in Columbus or at Alpharetta, you could do it that way too. And then when you do a search, you can search specifically or sort. If you want to look at just the core, plus 225 digital health companies, you can do that. Offering types. If you want to look at just the EMRs in the state, you can do a search for that and it'll show you all 29 EMRs that we have in the state. It provides a little short description here. And when you click on that, it'll take you to that company's profile page with more information. The sort features here include about 25, 26 different sort options. I've only mentioned a couple of them. There's a lot here. Public or private, startup, either pre-revenue or post-revenue. There's a whole lot of ways you can utilize this here. If your company wants to partner with a company, if you want to sell a company, if you want to invest in another company, whatever. There's a lot of different ways to utilize this. The other page, the third page I want to share with you is a company profile page. I picked Tele-Nephrology Systems because I want to show them a little bit of love because of this awesome platform they built and donated. But you can see a little bit more background, the types of services that they offer, and then also the segments that they serve. And there's more information below here. The screenshot just couldn't capture it all. You can see when they were founded, their employee count. Some companies will actually put a revenue range in here. There's the website. There's a lot more information as you go further down. And so if companies have more information, you'll see more. They provide more information. I'll share more of it here. And then if there's an edit button below this, if you happen to be the company admin for this, you could go down and click on that and then go in and submit updates. Tag digital health board members will receive those submissions, either new or updates. We'll review them and validate them and then update them. And we'll be doing that on a weekly basis. So you don't have to wait 2 years to get your company listed next time. So we've taken a lot of input from a lot of different sources for this. And again, we have built this because we know FinTech would like to do the FinTech Society. We understand supply chain's interested, media and entertainment. There's a number of other societies that are waving their hands saying, we have data, we'd love to use your platform. So this is something new, market research. We're very excited about it. We will be soft launching it, should be by the end of the week. And so we'll make sure we send out our communication on that. I will share with you, here is the URL. If you want to do a screenshot of that, you can go come back on Friday or Monday of next week, take a look at it and explore yourself. So I just wanted to share that with you, sort of do a pre-announcement as we get ready to soft launch that this week. We will hard launch it at our Digital Health Summit on March 30th. So we'll actually do a bit of a demo. So look forward to sharing that with you in more detail. The next 6 weeks, we want companies to actually go in and look at what we've preloaded for you. If in fact we have you in there, I'm sure we've missed a few companies. So we want you to add your company or go in and check your data and claim your admin rights for your company and go ahead and update that. One last thing I'll share before I turn it over to Jeff with Georgia HIMSS is here's our 22 events. I mentioned we have 6 events this year, starting with today, partnering with Georgia HIMSS, and you can see the others. So just be on the lookout for the additional events coming up. Okay, so Jeff Buda is the current president of the Georgia HIMSS chapter, and we'll share with you all what they do.
Thanks, Chris. And on behalf of the HIMSS Georgia chapter, we're pleased to partner with the TAG organization to bring this program forward today. A few words just about Georgia HIMSS. We are, you see our vision there is to realize the full health potential of all Georgians, and our mission is to reform the state of Georgia health ecosystem through the power of information and technology. A couple of accolades I wanted to share. We were selected as the large chapter of the year for the HIMSS Global Organization in 2020, and then also have earned a HIMSS Chapter Advocacy Changemaker Award. So we're proud of those achievements. A little bit about Georgia HIMSS by the numbers. We have 2,000 plus members statewide. We offer a number of educational opportunities with CEUs. So if that's important to you, we have a number of events throughout the year that offer that. We also sponsor some CP HIMSS and CA HIMSS certification review courses, and we'll have a little bit more on that in just a minute. Last year, we gave $29,000 in scholarships to students studying health IT or informatics, and we're on track to, we do that amount or close to it each year. So that's an annual scholarship fund. We offer a number of networking events throughout the year. Of course, a number of them recently have been virtual, but we're doing our best to keep the wheels on that and give people the opportunity to connect with one another. We have an advocacy and legislative agenda. An example of that is today's program where we're partnering with TAG. And then we have a number of sponsorship opportunities and a schedule of upcoming events you can see on our website. That's linked there. And if you can move to the next slide, I'll just give a summary of some of the upcoming events. You can see we've got a HIMSS reception coming up on March 15th, and that's the HIMSS National Show in Orlando. We have a networking event coming up at Top Golf, and that's the Midtown location on March 24th. We have the CP HIMSS and CA HIMSS review courses. Those are the HIMSS certifications. It's coming up on May 2nd. Our annual conference is May 3rd, and we are planning an in-person event this year at the Kopp Galleria Center. We have our 5th annual gala on May 12th, and that's always a lot of fun. And that's followed the next day by our annual golf tournament on the 13th. And then we're working on a lunch and learn on a cybersecurity topic. Haven't quite set the date on that yet. That's HIMSS in a nutshell. I'll hand it back to Brian.
Thanks so much, Jeff. Appreciate it. Yeah, we've partnered with Georgia HIMSS for a number of years on this particular event, and couldn't be more appreciative of the work that we've been able to do together on this particular event. Obviously, without our sponsors, we wouldn't be able to put on any of these events. So would like to thank all of our sponsors. I'd like to turn it over to David just to give a quick overview of Metro Chamber and let each of the sponsors give a quick little couple minutes.
Great. Well, thank you very much. Thank you. The Chamber is so committed to this ecosystem. I just want everybody to know if there are things that you're looking at and you need support from the Chamber, please don't hesitate to reach out. But in real quick overview of who we are, we're one of the only private chambers in the country. We started in 1859 and we've remained private ever since. And our goal is real simple. It's bringing jobs here and keeping them here. And those companies that are here, we want to help them grow. There's a variety of things that they may be eligible for that we would love to support them with, including our great partner at the Georgia Department of Economic Development, which is E. Jane Caraway, who leads this ecosystem, and Georgia Power's Economic Development Group, along with the local communities and cities, counties. So again, if you know somebody out there that's not here, let us know. We'll keep it confidential and we'll work that project. But that's it for the Chamber.
Thanks so much, David. And Chris Cooney from DSS.
Good morning, everyone. I'm Christopher Cunny, and I serve as Chief of Strategy and Business Development for DSS Incorporated, and specifically for our commercial line business under General Health. And I also serve as a board member and the chair of the Advocacy Committee for Georgia HIMSS. I'm very excited to participate in this program, and also my company is very excited to be a sponsor of this event as well. Just real quickly, DSS is a 30-year-old healthcare technology company. We're actually headquartered in General Beach, Florida, but we do have offices here in the Metro Atlanta area as well. We have a wide variety of technology platforms that we offer to a host of healthcare providers, including some of the largest healthcare systems like the VA and Cancer Treatment Centers of America, but also we have a passion for rural health as well. I'm excited to announce that we're launching our cloud-based electronic health record system for the inpatient market this year at HIMSS, called Juno EHR. It is a full suite electronic health record platform based on open architecture design. We are native cloud and native FHIR. And so for those organizations who are looking to move away from these large monolithic applications and systems that are out there, want a scalable, affordable system that is built based on some of the latest and greatest technologies, we'd love to sit down and chat with you about that. But also just wanted to let you know, again, we're excited to be a sponsor of this program and look forward to a very insightful conversation today. Thank you.
Thanks so much, Chris. And finally, we would like to thank Deloitte. They have been a long-standing sponsor of ours, both for this event and other events with Tag Digital Health. Unfortunately, they are up to their eyeballs in some audits going on right now, and it's just a busy time for them. So we did not have an opportunity to get somebody to speak on their behalf. However, just want to make sure that we include any contact information if you'd like to reach out to Deloitte and anyone from their team. Additionally, we typically will have legislators join us for this particular event. Again, both of these particular individuals, while we'd like to thank them for their service and being able to participate, they're not going to be able to participate today. Unfortunately, they are both not able to get off the floor. So we are not going to be able to get some legislative updates for this particular event, but we would like to, again, thank both of them for their service and for everything that they do for us here. That said, I'd like to turn it over to David again, and he is going to be our moderator for today's panel. So with that, David, take it away.
Okay. All right. Well, thank you again. I really appreciate it. And we're going to get into this rather rapidly, but I do want to thank TAG, a long partner of the Chamber, almost since the inception, I would think. In particularly you, Brian, and Larry, and my good friend Pat Williams, who reached out to me and asked if I'd be interested in moderating the panel. And I said emphatically yes. So thank you all. I'm a huge fan of the digital ecosystem, digital health. We were calling it digital health way back when, way before health IT, it seems. And a big promoter of the fact that Atlanta is the nation's health IT capital. In fact, many of you know, HIMSS actually started at Georgia Tech in 1961 by two professors. And as you well know, it's the largest trade organization there is for health IT and other technologies. So we do have true grassroots bragging rights. And I do want to put a special shout out there to the Georgia Department of Economic Development, in particular, E. Jane Caraway, who leads the ecosystem, because they are by far and have been over the many, many years, the largest financial contributor and promoter from a marketing perspective out of any organization in the state of Georgia. And in some cases, I would say up until recent, COVID periods, one of the largest investors in HIMSS as it relates to pavilions and marketing. So we thank the department for their continued investment. Okay, so let's get right into it. I'm going to ask each of the panelists to provide a brief 2-minute overview of their role and a fun fact about themselves that maybe the listeners don't know about or are not aware about. So be prepared. And we're going to start with you, Dr. Howard, who's the Assistant Dean of Programs, Morehouse School of Medicine. Dr. Howard?
Hello and happy Tuesday, everyone. I'm so excited to be here and I thank you all for this amazing opportunity. I am Angelita Howard. I serve as the Assistant Dean of Online Education at the Morehouse School of Medicine. We are excited about the work that we're doing, growing online programs. When people think about Morehouse School of Medicine, they instantly say, are you training doctors online? And so the short answer is we are training healthcare leaders online. And so that's from health informatics, biotech, and healthcare leaders beyond that. So I am excited to be here. Thank you. I'm excited about the panel talk today with my colleagues. And my one fun fact is that I'm a classically trained vocalist.
Very, very cool. See, I knew we'd get some cool things coming out of that question. I typically do like to ask that. Okay, so next, Steve Ferguson, Chief Information Officer for the Technical College System of Georgia. Steve?
Yes, sir. So I'm Stephen Ferguson, Chief Information Officer. I wear a few different hats. Typically, you think about it as IT, but the pandemic really has forced us into being business leaders. We were already trending that way. But thankfully, the technical college system has given me that opportunity to not only have an impact on the technology we adopt and use every day, but also to be a change agent and change maker within the system, particularly around healthcare and manufacturing and cybersecurity. So it's a lot of broad areas. We're a system of 22 colleges with 88 campuses here in the state. We serve over 320,000 individuals in any given year throughout the system. We're really workforce development for the state of Georgia. That's our mission. Healthcare is a big part of that. If you've been paying attention to the pandemic, you know that nurses and technicians and CNAs are in high demand. They're in even more demand today than they were even at the start of the pandemic, because a lot of people who could exit did. My fun fact is I've been the subject of and caused numerous international incidents by punching and kicking other people across the country. It was fully sanctioned. I was a kickboxing professional, and I fought for Team USA back in 2003 and 2004 around the world. So they allowed.
Did we lose him?
Oh, no.
No, I'm still here. Can you hear me?
Okay, yeah, you briefed out. You went out just for a second.
So I don't know if you heard the fun fact or not.
We did. We heard you're a tough guy, and you're in the right field.
Perfect.
Because if you need any healthcare, physicians, we know how to help you.
Very good, very good. Yeah, so I probably will need healthcare one day as a result of all those activities. So it was a lot of fun, and got to fight with Team USA. So
Cool.
great times.
That's excellent. Thank you for that. That's a great fun fact. Okay, so Damien Scott, Chief Executive Officer of Emmanuel County Hospital. Damien?
Hey, it's great to be here. And Steve, I'm a fighter too, but I've been fighting for rural hospitals. I am the CEO, as he said, of Emmanuel Medical Center. The last 2 years, we've been the #1 and #2 Georgia Trend Hospital of the Year. We are super proud of that. We should have never gotten that for this reason. We have consistently been ranked in the top 5 neediest hospitals in Georgia. And also, we are rated as one of the most necessary hospitals in Georgia due to our remote geography and our chronic health needs and our health disparity. We have been successful because I have a team of super dedicated folks that are passionate about providing rural health care. Fun fact from me is I am a native New Mexican. I have adopted Georgia as my home. The only thing is I have to have green chili sent to me, for those who know. And I am trying my darndest to visit every county and record birds in every county of Georgia. I'm about halfway there, and I'm going to keep after it.
That's great. I love these. Okay, last but definitely not least, good friend of mine, Marc Perlman, Managing Director for Deloitte Consulting in their global healthcare practice. So Mark's in this building with me, 191, but he travels so much. I think he said he was a 5 million miler, if I'm not mistaken. So Mark, tell us a little bit about you.
Well, the fun fact is I'm now 51,000 miles away from hitting 5 million, but I don't think it take that long to get there. And I don't consider that a badge of courage, David, but thank you. So Marc Perlman, I'm a partner in Deloitte's healthcare practice based out of Atlanta, Georgia. It's great to get involved with TAG and particularly Georgia HIMSS. I also happen to work very closely with HIMSS on a national level as their lead client partner. I've been involved in healthcare for over 35 years, grew up in the Georgia healthcare marketplace with time with McKesson, formerly HBOC along the way. And I've been with Deloitte now for about the past 7 years, where I've served as the global digital healthcare transformation leader and digital care leader for the firm, as well as a partner in the U.S. that works with clients on advise, implement, and operate type of solutions around healthcare and health IT. You know, we're all facing a very unique time right now. And, you know, the topic of labor and workforce development is not only a Georgia problem, it's a national problem and really an international problem in a lot of ways. So I look forward to having the conversation a little bit later. The fun fact I would love to say is I ended up meeting David through the fact that my wife posted a table on Facebook Marketplace, and they connected. And one day David came over to the house to look at the table, and we found out we had a lot in common. So I'm glad to be here. Thank you.
That is funny. The table is very unique. This is a hard table to find. It's a 48 by 48 marble top, coffee table. And trust me, we looked everywhere for it. So when we went out to Marc's house, it was quite fun, and we stayed in touch ever since. So, and I'll say just a quick fun fact about you. So he turned me on to Lulu pants. If you have not tried Lulu, is that how you pronounce it?
Lululemon, ABC.
Lululemon. For the guys, check it out. They're great pants. Okay, so before we go on, I just realized I didn't give my fun fact. So I'm actually a Southern Californian. I was born and raised in San Diego, a small place called Coronado Island, and I'm a lifelong surfer. All my kids have tried to surf. One did okay, but I raised them here in Georgia. And so they're wonderful Southern gentlemen. And I'm just so blessed that we found Atlanta. We've been here since 1995, and it's the best decision I've ever made, and I'll never go anywhere else. So that's my fun fact. Okay, so let's go ahead and jump into it. And Steve, I'm going to start with you because I think it's incredibly important, as we know, and there's an immediate need, on, what is Georgia doing or need to do to solve the lack of the healthcare workers, particularly around digital health. I think I heard the other day that there were 34,000 open, nursing jobs. So on the digital realm, or really anything to do with the workforce, let me know a little bit about what you think there, Steve.
The whole is focusing on this across multiple areas. The technical college system is all in on training healthcare workers. Digital health is an area where the pandemic really helped push that to the forefront. The telehealth piece, we were actually allowed by the Georgia Board of Nursing to utilize telehealth as part of clinical time, or not full, but as part of the clinical time required for a nurse to become certified. That started during the pandemic. We would anticipate would continue beyond that. We're also adopting a lot of simulation technology in our labs to facilitate the long-term usage of not only or long-term viability of training, particularly when you couldn't get on site. What that did for us overall was let us be more nimble with training. It also let us expose individuals who are pursuing healthcare careers to technologies that typically they wouldn't have without this opportunity. So, in a nutshell, we're leveraging technology to improve what we're doing, but also get those early adopters into the pipeline right now. As a state, though, how are we solving this problem? For CNAs that were in high demand during the past couple of years, we actually developed and worked last summer, developed and rolled out a short-term CNA program that gets more people in sites sooner. We rolled out a nurse reentry program across the state that allows us to get folks that have become unlicensed at some point in the recent past to pick back up their licensure right away, and we can put them back in the fight quicker. The governor, in his budget release for the state, but also for TCSG, has funds in there specifically to target enhanced and improved and growth in our nursing and healthcare programs. So as a state, we've heard loud and clear that we got to not only make immediate gains, but we got to have long-term gains as well.
Okay, that's great. Now, one thing I'm just trying to flash back at this. I know that in the early days of Georgia really taking the ownership and getting on the podium and claiming the fact that we're the nation's health IT capital, there was the lack of workers even back then, and I think we were the first baccalaureate and technical school certificate ever produced in Georgia. And what I mean by that is Georgia Tech and Gwinnett Tech got together to develop a certificate program for health IT workers. And frankly, I don't even know where that is, if it's even still going on or not. Pat Williams was instrumental in making that happen with the legislature. Steve, is that still around? Do you happen to know about that? Steve? Well, we'll go ahead and go on, and Steve, if he comes back on, he can comment on that one. Dr. Howard, let me move to you because the talent pipeline is critical as we move forward. So again, what is Georgia doing now or need to do to prepare for the future healthcare worker? And not only from an educational perspective, but also on boots on the ground. And if you could do a slant on the importance of digital health, I think that will be important as well. So Dr. Howard?
Yeah, absolutely. You know, Georgia and its schools should develop partnership with people like HIMSS. We talked earlier this morning, or HIMSS showed what they're doing in the community, Georgia HIMSS, but other clinical affiliations, so that these entities can help educational institutions design programs and pipelines in digital health. If you do a Google search today, you'll find just in the Southeast region, including Georgia, like 5,000 jobs that have health informatics in there somewhere, digital health around that. And so we've seen over the last decade about 40%, this increase in this field go about 40%. So with Georgia having top critical care units in its capital city, we've got to be at the forefront of exposing students to digital health. Daniel talked about rural and rural areas and rural hospital. And he made a comment about his hospital should not have been selected, but we understand because of, having things like digital health, the importance of it when it comes to those rural areas. Listen, the exposure can and should start before college. In fact, if you think about K through 12 in digital health, we can expose students early on. They use iPads, tablets, smartwatches, cell phones. And so we can teach them about digital health, how to measure blood pressure and record it, and then go back and measure it again a month later, right? And record it and really show them how that progress goes along. So we have that capability. Morehouse School of Medicine, what we've done, we've created a pipeline, a summer pipeline. It's our pathway to master's. It's called the Bridge to Health Informatics. And the focus around this program is to provide undergraduate, juniors, and seniors and post-baccalaureate students with exposure to digital health and health informatics, if you will. So during these 5 weeks, during the summer, they're provided. We partner with HIMSS and other organizations to really pull this off and to really build this, to expose students for 5 weeks. They are provided intense daily lectures and activities to enhance their knowledge around health informatics or digital health, in hopes that they will choose to go into the master's program and get further education, or that they will take what they have and combine that with what they're doing and work more in digital health. So we've seen people come in and change career paths. We've seen people who are currently in the healthcare field but want to move more to the digital space. So we've got to continue to build those partnerships and those work partnerships so that we can create more pipelines.
Perfect, thank you. And I was remiss and did not say that if any of you on the panel want to jump in on any of these questions, just feel free to do it. I think I've got everybody on the screen here. Put your little hand up and I'll call on you, or just jump in if I don't or I miss you. And then as we get closer to the end of the time that we have, we would like for those listening to also submit their questions. And where we can, we'll certainly try to answer those, and where we can't, we'll take it upon ourselves to take that back and do whatever research is necessary to get you the answers that you may need. So if you could just remember that's open to you as well. So Marc, what does the future of the care delivery model, which everybody's talking about, look like as it relates to digital health and other areas if you want to talk about it, but mainly digital health? Marc?
No, I think that's a great question. If you look forward, hospital systems today are looking to really virtualized. There will be a health system without walls as we start moving forward. And as healthcare starts to evolve, only the sickest and most complex patients will be in the hospital as we traditionally know them today. With that being the case, and we start looking towards the future of health, the question then becomes is how do you create a digital healthcare fabric, I would call it, that would actually provide continuity of care irrespective of the care setting. The care delivery network is going to change in terms of where you will get your care. The capabilities of what you can get in the home will go quite far. I mean, if you look at modern healthcare for this week, it talks a lot about hospital at home. Well, that is a combination of being able to take very acute patients to a different setting, having better outcomes or similar outcomes. And we will see it get to the point where one day health systems will probably have what I would call a digital healthcare suite. And instead of necessarily having an ICU, they'll have a digital care suite where people will be in a room or maybe even virtually somewhere, anywhere in the world potentially, and actually monitoring and taking care of the patients, and then relying on the community and other ecosystem players to help support it. Digital healthcare, it did get a nice kick through COVID, no question about it. But the question we also have to look at is if we continue this evolution of getting, high quality healthcare that can be more cost effectively delivered, because we all know that the cost of care in the United States is way out of sight compared to the return we're getting. We're going to need to invest in digital technologies, whether it be for monitoring, different care models of how we support in the home or acute, and then how do we start taking care of caregivers who may be a family member or may be an allied health professional? How do we give them the support networks they need through digital capabilities and or artificial intelligence to be very effective on it and kind of help them really humanize what's needed? So the care delivery model will change. What we will see in 5 years will be much more less, I guess, bricks and mortar, and the digital fiber and the technology to support that process will be proliferated, is my view.
And Damien, this is right up your alley. Do you have any thoughts on this or anything you'd like to?
Yeah, Mark, I'd love to spend a day just talking with you about these subjects. But I think part of what you described is what's happened to rural. You said that only the most complex and the sickest patients are going to be in the hospital. We've already seen that shift. And what's happened to rural is they've maintained their expertise here. And so we have all of these empty beds now because the patients, the expertise for those who are going to be hospitalized are at our larger facilities. And so the way we bring that back is telemedicine. And I think that's going to be how we, a big part of how we get rural back in the game.
Okay, so super interesting. And we've been following this through the legislature for quite some time. So I do want to drill down a little bit on this, and anybody can chime on this, but I am going to ask you, Damien, one more time. The implementation of digital health, especially in rural healthcare, for the most part in rural healthcare, what are those roadblocks? And the kind of things I think of is access to broadband. Users and providers adopting. That adoption is incredibly important, and especially if there's a lack of technology hardware, and if there's a lack of skill to work those systems. Are you seeing that as a hindrance as well, I would assume?
Well, I feel like I'm equipped to speak to this because we put in a lot of telemedicine. We've been some of the early adopters for telemedicine, and I have failed multiple times, and yet I've also had some successes. Where you will have failure is if there is not a good relationship between the clinical partners. Either if you have either a bad relationship or no relationship, it will fail. Also, both sides need to be fully ready and willing to change. And then the last part, and this one I don't think we've fully gotten a hold of yet, it's got to be beneficial financially for both sides. Yeah. We have set up telemedicine before where we could provide high quality healthcare out of the Atlanta market from an expert in the Atlanta market. But guess what happens? We're on board for it. But as soon as that expert in Atlanta has enough volume in their own clinic, they pull away. And so That has happened to us over and over again. The only times that we've been able to make telemedicine work is when there is a financial benefit for both sides, or the other side is so mission minded that they may not be right yet financially, but they're either trying to publish some papers or they think eventually it will be financially good. But COVID helped. As Marc said, COVID certainly helped because the payers have made it so that there's a little bit more equity related to both sides, I think, for telemedicine, but there's more that we need to do.
Yeah, Dr. Howard, let me ask you, the small hospitals, critically important. It's what we should all be serving the underserved and getting, what we have the luxury of seeing here in Atlanta, Metro Atlanta, to help areas that are in great need. What types of, telemedicine is not going to help everything. There is a triage in the sky that happens, but where do we see a lack of delivery to the patient who are out in rural healthcare? So maybe they get diagnosed over the phone, but then what do they do after that? Is there anything that you think can be done or should be done in that realm?
So again, there is, we talk about this whole thing around mistrust. So we've got to create a community of trust. How do we do that? We've got to make sure that we are educating Black and Brown people. We've got to make sure that we're giving opportunities more for Black and Browns to be physician, PAs, NPs, because honestly, we can think about the Tuskegee. People hear about the Tuskegee study of the untreated syphilis. People hear about what happened with Henrietta Lacks even today, related to her cancer cells, that her family still not being properly funded. We know about the surgery, the Dr. Sims and his surgical practices on enslaved women. So people with social media, we continue to see this as we hear it. People put things out there, so they're afraid. There's a mistrust. Even when we talked about the COVID vaccine, people in underserved populations, rural areas, they didn't want the vaccine because there was mistrust that was created. So, it takes a long time. It takes years and years, and as we've seen, decades and decades. But what we can do is make sure that there are measures in place to help break down some of those barriers and creating more opportunities for people in these spaces who are minority serving or who are minorities, and that can help to tell the story, help to be a part of the story, help to show that it is okay, so that people are not ending up only at the hospital when they're really, really sick, but that they get that type of care, even if it's through telemedicine, is talking about digital health, but that they get it early on through their primary physician, and a primary physician who looks similar to them.
No, Marc, let me ask you a question, because I think it's all going to be about technology. Certainly we got the payers, they got to pay for it, or we're going to look for alternative paths. But the type of technology that maybe you're seeing on the inside, because you're talking to people all around the globe, are there new technologies that you feel comfortable will help with some of this?
Yeah, I mean, I think that, the cloud is early in the journey, and, it can certainly be the background and the fabric, again, that people use to store data and actually help move information around. I mean, the core to being successful with telemedicine or any digital health experience is what I like to call radical interoperability. We've got to have systems that talk. We have to have systems that are flexible. We have to have systems that don't create walled gardens, as Dr. Massari said when we were going through meaningful use. We've got to think about what the technologies, and it was interesting. I was on a call earlier in the week with a former colleague who's looking at health equity issues. And when you start looking at rural communities, there is a lot of times not the broadband, like you had indicated earlier, or the capabilities. So the technology has to be able to support things like 4G, 3G, whatever it may be, to have a point of care or device. So we've got to think about how do we leverage, high-powered backbones that can give us a lot of that interoperability, and then point apps that will actually be able to engage in the way, shape, and format that people want to be addressed. I mean, one example of care, for instance, is that, you know, I personally, my father, who passed away, was a type 1 diabetic. My wife is a type 1 diabetic, and one of my children is a type 1 diabetic. And, you know, if you wanted to do an intervention, or if you saw that their blood sugars were going off or whatever it might be because you were monitoring remotely, you better had called my dad or my mom. You could probably email my wife or give her a phone call, but you better text my daughter, and it better be at the right time. So we have to think about channel strategies and ways to engage with people. It actually, to Dr. Howard's point, to make them feel comfortable engaging within the health system. And a lot of that's going to be channel management and the ability of moving the data around in an interoperable fashion.
Yeah, I want to go
ahead.
to Marc. Yeah, I want, because guess what? He just talked about texting, emailing. So when we think about social determinants of health, if I don't have access to
Yes.
email or even transportation, then again, I'm stuck. So we've got to, and I appreciate the analogy you use, Marc, on someone being able to text or someone being able to email. But if I don't understand email, don't have it access to it, or broadband because where I live, then what are my options then?
That's actually really good, because we got a chat here, and it says that they heard on NPR yesterday that 3G will no longer be supported, and the impact on rural residents, you know, that's devastating, right? That's if they have a phone. I mean, if you haven't been out in rural Georgia, you will be surprised what you see, or may not be surprised, but it certainly is something, you know, that has to be solved. I mean, period.
David, I guess another analogy is like you don't necessarily need a cruise missile to kill a fly. You need to find the right level of technology that will actually get the job done.
True. Steve, I see your hands up. Steve, we're having a hard time hearing you. You're on mute. That should work. Steve?
All right. I'm
There you
here.
go.
Can you hear me?
Yep, we can.
So I think earlier something else muted me. I couldn't unmute myself. So, you know, the reality for 3G is it is going away. Time and technology are changing. If we're going to advance and move forward, we do have to, you know, sunset some technologies. That is going to have a disproportionate effect, particularly on rural Georgians, but it's not limited to rural. If you look in the metro Atlanta area, access does not mean you have access. There's still there's an equity piece there, you know, for the availability of funding to actually afford access in the phones or other technology. One thing that the state is doing is we're making massive investments. The governor announced recently, you know, over $400 million into broadband. The federal government has been doing subsidies for those that are economically depressed or in certain areas that can help pay for broadband access. But there is an awareness piece of what's happening and what's going on that we have to help spread, because, you know, just because there's a program available doesn't mean people know how to take advantage of it. A lot of times you've got to sign up online to get access to get online. So that, you know, creating opportunities and pathways for people to get access to these programs, creating awareness of them, but also creating, you know, or reinvesting in libraries and other centers out there where people do go, particularly in rural areas, to get access to the internet, and making that a place where people can utilize potentially some private area for telehealth or telemedicine, if that's their only access because they don't have it at home or can't afford it, or there's no coverage. So there's a lot of different pieces at play there, but the state and the federal government are working together to help bridge that divide, making people aware of what's happening is going to be a big part of that.
Hey, Steve, let me ask you this. this is really technical stuff. I mean, what Marc said, and I know at one point we had an amazing interoperability lab here with Dr. Mark Bronstein. And is the technical school prepared for, or even, the Board of Regents, are they teaching these students the skills, those high level skills to be able to, understand this, then get into the system and support it and provide that delivery of care to patients? Because you can create anything that's fancy, but if you can't get it to where somebody can help deploy the technology, we're in trouble. So Steve, are you looking at that upskilling?
The modern programs are using digital technologies. We're using virtual simulations in labs. So a nurse today is having just as much exposure to technology as they are to patients, in their clinical rotations. The pandemic certainly helped usher that in, but that exposure is happening very, very early. You even see the CNA levels that are now the certified nursing assistants that are getting exposure to telehealth style technologies. That's not everywhere all the time, but it is a part of the training. And someone said earlier, you've got to expose people early to this. Otherwise, it's going to be a learning curve, when they're ready to go into the workforce. So getting in there now, the labs and things have to be upgraded. We've been investing in and upgrading those labs to make sure they're getting access to modern technology. But it's a long-term fix, right? Because people who are exposed today are going to be in the workforce in 2 years, 4 years, 8 years, depending on where they are in their educational journey. So we're playing catch up in some parts of that because the technology's out there right now. You heard the gentleman earlier talk about how he had rolled some of his telehealth technology out and failed, mainly because the different parties just weren't on the same page. Different people had a different understanding of what this was. So we're really in a very difficult time for adoption. But with broadband, going out there in much higher density than it has been, with the shift to 4G and 3G is certainly, that going away is a problem, but 4G provides more bandwidth. And so you're going to see more investments in LTE and 4G access and 5G. That means there's going to be more opportunities for telehealth and people who have technologies to take advantage of them. There are digital divide issues, no doubt, but change is coming. It's already here.
My phone's blowing up. It's interesting because I'm watching the chat that's rolling. I'm getting texted for those who have my cell phone number. And so I think we're going to have a lot of follow-up, but these are amazing questions. And I love the passion. We've always had passion in Georgia. Sometimes it's passion for the wrong things. Sometimes it's passion, for the good things. But we are not short of passion in this community. But I do believe with all the discussions I've had with all the different variables in this community that we're genuinely committed to making this happen. But it is a huge hill. VMR, Valerie Montgomery Rice, who's president of Morehouse School of Medicine, is a dear friend of mine, and I'm always getting hit on the, healthcare equity. And I absolutely agree that we've got to do as much as we can to spread to the world that we need help. I'm going to pause.
David, can I make a comment?
Damien, I was just going to go over to you. I saw you kind of getting ready to lean in.
Yeah, I was like, okay, so let me just mention, somebody said you got to have the right technology for it. And what happened early on with telemedicine, we spent all kinds of money on these amazing carts. I mean, they could look at like you down to the cellular level when that camera's on you. And we spent a lot of money on projects that didn't work. And what happened right before COVID, we had developed a telemedicine to back up our ER with critical care doctors at AU. And I just could not get it off the ground. And then COVID happened. And one of my docs said, hey, you remember that telemedicine? I need that. And I said, okay, when do you need it? And he said, in the next 15 minutes. And so this was our first telemedicine doc to doc. And in that program, and it's probably our most successful program. So what we found out is we didn't have to have all of these amazing cards. Now we do have a card that allows them to do some things, but mostly they need to have doctor-doctor conversations. They need to be able to have conversations with the patient, and they need to access the electronic medical record.
Yeah. Anybody else want to chime in on this subject? Okay. I want to kind of ask a let's call it a wish list, because oftentimes people, I always say, I was talking to some of the young folks here in the office, the Crystal Ray, which is a school right around the corner, and I told them, hey, a dream is in your head, and a goal is on paper. And so I don't want to say wish list. So what do you feel should happen technologically in the next, say, 5 years, 10 years to start really solving this problem? I mean, just almost something that's not even here yet, that as a CEO of a hospital, a consultant, an academic, someone who's leading a technical college. What do you guys want if you had that wish? Anybody can jump in and anybody can follow, and I won't call on you, just jump in. You're on mute, Damien.
Of course. I said interoperability.
Okay. Yeah.
If you walk into my little rural hospital just for simple lab work, you'll go through 9 different IT platforms. 9.
Wow.
From the moment you walk in till you get your bill. And it is a full-time job to make sure that those are communicating well. When we started with electronic medical records, didn't you think, I mean, I did. I'm a clinician. I'm a physical therapist. I thought that meant that if I was seen here in Swainsboro and I went to Atlanta, they'd be able to pull up my medical record. We are still not there. We've made steps there, but we are not there.
Okay.
Yeah.
How about you? Anybody else?
Yeah,
I know you have wish lists.
Yeah, Damien, I'd agree with you totally. Interoperability and the ability of these systems to not only talk is great for patient care and access to care, but frankly, it helps lower the cost of care or of providing it, because the testing, the interfaces, the integrations, the upgrades, keeping them all in line are always a challenge. So I do think we need to look at more integrated, more interoperable capabilities, whether you do it at an HIN level or wherever you do it. We've got to start exchanging the data. The other thing that I would say, David, is that we need to think about labor and where we're going to obtain it in the state. And we can either grow our own, and hopefully people will stay and help work within the rural health system and in the cities and everywhere. Or, frankly, this is becoming, because of COVID, people are now working virtually. I mean, I was on a phone yesterday with a hospital in northern Michigan who was getting help from resources for their EMR from Oklahoma. So now that we're virtualizing employees, people are working at home. Jobs will go out of the state if we're not careful. By the same token, if we can train folks to be and build a network of really strong digital health professionals, or maybe even organizations or companies that can happily supplement them here, I think we have an opportunity to bring more revenue into the state. I think that's part of the things we have to think about.
I would agree 100%. Certainly interoperability training our own, that's what we want to do. And the final layer that I can only say is broadband access to those who do not have it in those communities. So T-Mobile, if you're listening, Sprint, if you're listening, Microsoft, Apple, all of you that are listening out there, go to these places and build towers, build access for people to have access.
Interesting. So I just had this thought, I come from a medical device commercialization background. I spent most of my career developing technologies. And one area that I worked on was extracorporeal lithotripsy. It's a crazy word, but that's how you get stones out of you, kidney stones, gallbladder stones. And what they did was drive a bus, to the hospital and docked it, plugged in, and saw a boatload of patients. Should we, and I know I'm talking to one company, so you referred to it a little bit there, Dr. Howard, a G5 portable unit that can come into a rural healthcare, even if it's a satellite-based technology that's shooting satellite images, that they just can't, pick up a signal. Is that feasible? And Mark, I don't know if that's something you've seen, because you see all sorts of double secret handshake stuff, you know, that DARPA world that you live in. Is that possible?
Well, Mark can certainly answer, but I will say this. In 2007, I was working on Fort McPherson on the military base. And I was working for a college there, and the I don't know, the entire system like went out, internet system. And so at the time we had those, do you remember those little digital virtual remote where you could get into to use the internet? So like a hotspot, that's really when hotspot first kind of was hot, and you would have the portable hotspots. It wasn't on your phone. And so because we needed to get students registered, we had things, we didn't have access to the hard wire. It wasn't working. Our internet was out. It was crazy. I went to Verizon and I bought us hotspots. I bought 2 hotspots, and guess what? They worked. They it was 2007. So that was, 13, 14 years ago. But certainly, again, you all are certainly more the experts in the technology. But if we were able to use that one hotspot, everything was out. We didn't have the blue cord, the Ethernet, none of that was working for us to access the internet. I am certain that technology and what we're capable of doing today, we can drop some, we have drones, we have capabilities. Certainly we can drop whatever it would be so that people can have this access. But Mark, I'll defer to you.
Yeah, I mean, it gets down to time and money. And certainly anything is doable with time and money. And there's examples of where they're doing surgeries remotely, robotic surgeries across the Atlantic Ocean now. It's not an inexpensive procedure, but we can certainly drop the technology here. And I think the question continues to get back to what is the most appropriate, cost-effective technology that actually solves the problem. Because I know that Damien in his hospital can't afford, a super laser every day to go solve a problem. So what we've got to really think about is what's appropriate, what's needed, and how can we support it long term. I mean, another concern that I look at here, we've got to really look to address it at some point, is cybersecurity. There are hospitals that are getting locked out right now and closed down and having to go back to paper because they've gotten hacked or somebody's looking for ransomware. And so, we've got to balance all that against the new bright shiny object that may be the thing that cures most. But how do we actually, have health equity among all with the right technology, and make sure that it's safe? Because we do have a lot of cyber threats these days.
I think we have the technology to do some really cool stuff right now. We're one of the only hospitals that's doing this tele consults in our ICU. There are some other projects out there that are very expensive. Ours is not. But one problem is that when those critical care docs help my doctors evaluate and treat a critical patient in my ICU, they get paid less than if they were to turn around and treat the patient that's right in front of them. And I would argue it takes a little bit more work. And we're not talking about individually big dollars. And I would argue too, if we save the system money by paying them a little bit more, by making that a sustainable model, because then otherwise you're paying for a helicopter ride or an ambulance ride to Augusta University or to some other organization that's going to have higher costs than what I'm putting out. And so I think we have the technology there. I also have a program where we do Tele-Nephrology. My nephrologist is at Emory, has never been set foot in this facility, but we're able to dialyze patients right here at Emmanuel. So the technology is there, but we have to subsidize. We are subsidizing that right now, or we're basing it on a grant. We've got to make it a model that works long term. And I think we're really close. COVID helped because Medicaid in Georgia now, Medicaid will pay us the same thing for telemedicine. Medicare does not. In fact, on my outpatient, we're paid a fourth of what we would get for a live visit. So that's got to change.
Anything else, Steve? Any thoughts on that?
Yep. Can you hear me now?
Yes.
All right, I was able to unmute myself. Congratulations. So yeah, technology is certainly there. I do want to echo something back earlier of the interoperability discussion. That's probably the biggest challenge in any sort of nascent market like this where it's still growing. There's going to be winners in the technology space. There's going to be at some point a consolidation of many of these technologies. What's really going to be difficult is just like we were talking about a second ago, as smaller rural hospitals are on the front end of this and making their own investments, did they make the right one? Is that the one that wins? And so it's going to be incumbent upon technologists to make sure that not only do we support interoperability, but when new technologies kind of take foot, we can't just overhaul the entire ecosystem, every time some brand new, flashy thing comes out. So we've got to work really hard to make sure that the technologies are going to work together. We've also got to work on the data sharing pieces. We talked about this electronic medical record, electronic health record, piece. If you go to a hospital in rural Georgia and you come to Emory, they automatically know your stuff. The technology is there to support that. A lot of it is the data sharing, and it's going to be the technologists and the lawyers that get together and say, hey, we're willing to enter into agreements together to share this data for the benefit of citizens. And it may take legislative action to get people to, the ability to do that, but also the requirements to do some of that sharing that needs to happen. Obviously, patients, they're in charge of their medical records. We have to honor, their requests, but we do have to work really hard to make it feasible and possible for that information to be shared. So the technology exists. It's just the impetus to push us there. Because it's not easy work. It really is easy work, particularly when you're talking about those integrated systems that live in silos today. That's going to be very difficult, time-consuming work. Somebody's got to make the investment. And, right now it sounds like the rurals are leading the charge in many ways in that space.
So it sounds like, there are solutions. And, Mark, time and money is always what we get back to in the business world. And so I completely hear that. I think there are immediate needs right now, and people are dying. I mean, let's just be candid about it. People are dying because they don't have access to healthcare. And that's not just the rural. I'm looking over at the south side of Georgia. So, I mean, go to Bankhead, go to Grove Park, walk there. There are no sidewalks. There are no lights. There is no hospital. The Ubers will not go to the neighborhoods. So if you have a single family, or doesn't matter, a parent who has a child who is sick, what do they do? One of the only things they can do is call emergency. If they have a phone. I mean, that's how bad it is. This is like a third world country in certain parts of where we're at. And I think until we can really get together as a society, I'm getting on a soapbox here. Sorry, it's just part of what I live every day here at the chamber. Then we're not going to solve this, because the best lasers, the best, mobile, 5G, trucks, that's going to need people. And so if you back way up, and one of the questions that we had was, we got to start them in 7th grade. We got to let them know that there's a career path for you to get there. There's the immediate need that we may have to upskill people who are in programming and had no idea that they could be in healthcare. But if we explain to them, look, there's a path here, you had no idea that you are qualified to get in here. And so sometimes it's just getting the word out there that you can do it. You can do it. Let's just give you that opportunity, and where you go to learn it. It could be the technical college. It could be an apprenticeship at the hospital. I'll go so far to say, and I'm saying this in front of somebody who's 2 educators here, sometimes they come out of high school and they're ready to go, so let's get them in the field, So I'm encouraged that there's a discussion going on that we can solve the problem. I believe that Atlanta, Georgia, for that matter, all of Georgia, has a lot of really smart people with a desire. It's just really circling that wagon of brain trusts and saying, what do you have? What do you have? And can you get that? And kind of put all our, business objectives aside for the greater good. So there's my, it has to be the last word I say because I'll just keep going. I've got a lot of questions that have come in, and it's 12, roughly 12:45, and we have probably about 10 more minutes. So I'm going to ask, let's just do a somewhat of a rapid fire. And that is, and I'm going to say this in a way that I've learned a lot when we do this, and it doesn't necessarily have to be you and your organization, but what do you see as the biggest failure that you've seen that we've learned from? So we tried this, it failed, but man, we learned either how never to have that happen again, or we learned that we can now do this, and that went to a solution. Y'all may not have that, each of you, but is there anything you can think of that failure led to a success? Anyone?
I would say, I would say our failure to think about how we educate people, failure to think that we can only educate people in a classroom doing lectures for 2 or 3 hours and not giving them an opportunity to educate them digitally or through online education. There are certainly, you no longer have to sit in a classroom because sometimes Marc said it, time and money is not there, or the time is not there, especially if you're working for a family, you have a job, you have kids, and we're trying to push more people into this space that is a technical space. Then let's create more opportunities for them to be where they are and train them where they are and get them working. And that could be from wherever they are. They don't have to come to a centralized location in order to do the work that we need to do for them to get out into the work.
Good. I get that. Damien?
I think my DNA has really changed because of some mistakes that we've made. I came in here really wanting to change the world. And I thought that was going to happen by us writing some grants and getting the latest, big, greatest technology, something expensive. And it really failed. And I've since, whether we're doing a building campaign or a new project, how can we build this with, just some sticks and some willpower? We get so much further than trying to have this big, great program. And so it's changed my whole DNA by some of those failures that we've had around projects where I thought it was going to bring in, something the latest and the greatest technology.
Yeah, David, I guess I would say let's remove barriers wherever we can. I can't think of anything as a failure necessarily, but when you think about your barriers to telemedicine, your reimbursement, let's make sure this is permanent. Let's make sure we really go in and look at the legislative aspects to support the end game we're trying to get to. And if we do that, we're going to have a much more viable healthcare system. And let's then go back and say, let's solve this problem of getting the rural communities connected. If we do that, we then create a baseline of quality that we can start building from. And it's time just to go ahead and do it. I mean, I know the governor of Arizona just signed a major bill last week to completely take the internet throughout all the Indian and rural communities. They're solving the problem. We need to make sure we do that.
I was not aware of that. Maybe we could do a follow-up to those who are online and share that, because I was going to ask are there case studies out there that we could be following? Are there areas from Missouri to Arizona that are doing some of the right things that we can share with our leaders, be that a technological leader, from a corporation, consulting company, academic, healthcare, legislators? I think we can get enough of those use cases and say, this worked, we ought to try it. Could be part of the solution moving forward. I'm just a firm believer we can do it. It's just a matter of time and money and desire. You could have all the time in the world and all the money in the world, but if you don't have the passion and the desire to solve a solution, then there's no reason to do it. And
I want to make
Steve?
Yeah, I want to make a point based off of what Damien said earlier, really quick, and your desire is the right term there. You know, I think the biggest thing that we could all learn from is that we're no longer living in a "if you build it, they will come" world, and so we've always defined what people can have access to and what technology and things we're going to roll out. And I think what Damien's really speaking to is, hey, we've got to react to what the market wants. And the market wants, very specific ways of interacting. True in healthcare, but also in education. We said that this is an on-premise. You got to be in the classroom. You got to be in the lab to learn this. Well, the market said no. We want to do it online, and so. But we've got this really great lab here for you. You got to come and use the lab. Well, no, I want that lab, but I want it online. And so we've got to react. I think the biggest failure we've all probably been guilty of is, we've put something in place and said, this is how it's going to work. And the customer has really stepped up and said, nope, you got to change if you want my participation there. That's healthcare, that's education, that's every business available. So we're shifting. We're making those changes, and I think healthcare is going to see the same thing. As the market is going to create opportunities. We just got to be ready to take advantage of them.
I'm going to go ahead and shift now to open it up for questions. And I've been reading the chats all along, getting kind of caught up in that. But this has been an amazing discussion. I'm going to open it up and ask the audience if they'd be interested in asking a question. It's got to be very succinct because we've got like 10 minutes left. So, Chris Carabinos, I know you have something to say, right? You are always the one I go to. I think you're one of the best promoters and resources that we have in this space. So, tell us a little bit about what you're going to ask, and we'll start with that.
I appreciate that, David. I guess I should open my camera back. We've talked a lot about the application of technology. And I know the topic here is about jobs and the dearth of jobs, and the fact that we need to put people into the pipelines and move them through the process here and get people with the right degrees. I know Morehouse has started a master's degree in health informatics, so that's a huge help. I think KSU has one. I think Georgia Tech had one in the past. I mean, so do we have anybody looking at the overall picture? Obviously, we've had thousands of open jobs in health IT for the last 10 years. Every year I see reports, and we just don't have enough. And even working people remotely, we can't, it seems like we can't get enough people hired here. And the more companies are hiring, opening up huge data centers. Is there somebody looking at the entire picture, trying to figure out what else we can do to, maybe it's more universities, maybe it's helping fund Morehouse or KSU or Georgia Tech to open up their programs even more, because we need more people. We can't hire enough people.
I'm going to open that up to the panel.
Yeah, I'll start. Absolutely. Some of it is, again, the exposure and getting people in once they've had, let's just say, $40,000, $50,000 of undergrad debt, and then going into a master's degree to try to get, because jobs are saying, hey, you need a master's degree. It's automatic. Master's preferred, master's degree. So like Atlanta Tech, they have a great health informatics program. How many students are coming from there doing what type of job? So either we have to think about how do we reclassify some of these positions and roles so that we can get people from technical colleges or from 2-year junior colleges or at the undergrad level, and or scholarships and funds to train people at the graduate level. Because even with our program, it's in the 30,000 mark, which is average, lower than a lot of your programs. You still have people who may not be able to afford that, or again, back to the exposure, knowing that these programs are available for you, to take.
Okay. Others?
Yeah, I'll echo what she said. We've got to have the employers participating in this. So if every job you post requires a master's degree, we got to go back and evaluate that. Figure out what are the skills needed and where can those skills be learned. So think less about just degrees. Think about a skills-based economy if we want to meet these needs, particularly when it comes to health IT. what is required. You can't just recycle the same job descriptions. Another big component here is when the employer, it's not that people aren't willing to go through the work and get there. It is an awareness campaign. With an employed workforce like we're working with today, everyone's trying to get people interested in what they do. And so we've got to have the employers, out there partnering with the technical colleges, partnering with universities and saying, look, if you want to work here, we're hiring from right over there. We're picking up grads from these institutions and we're hiring right now. That's going to get people interested in the programs because everyone is fighting to get them interested in, the STEM career or the STEM it's going to lead to a career in whatever field they're in. And so, health IT, it's an awareness piece. It's getting them early. It is getting students interested in high school and in middle school in a career in this field, and then helping, facilitate that educational journey.
We, we don't have a lot of folks around here with master's degrees in any area. And so, but a lot of rural hospitals, what they did, rural hospitals are broke, y'all. And so if you're broke, what do? You cut training. Bad idea. We have reversed that trend and we've got training dollars available in every department. We offer scholarships. So we like to grow our own. And that's been a very successful model.
David, I remember looking at Pat Williams on this call here. With IHIMSS, she put together that Lieutenant Governor's panel, a series of panels back in 14, 15, or whenever. And he actually got a lot of universities on one side of the table, a lot of businesses on the other side of the table. And I was on the business side of that panel. And he basically challenged universities to start more degrees. And that's Sweta Sneha, Dr. Sneha at KSU used that to go to her management and actually to help start a Master's of Health Informatics program. Maybe it's time for something like that again here. Get the Lieutenant Governor, yourself, or somebody else to actually pull some high-level people in the state together to have another sort of moonshot challenge again around this. And maybe we can get some more universities and maybe even some more funding to help out the Morehouse and KSU and others to expand their programs. Just a thought.
So David,
Pat Williams,
yes,
I see you up there.
I have to say this. I can't not say it. And Mark, thank you. You're going to be part of this whole thing. So I is actually involved in working with the Department of Education to bring awareness to the teachers and to the students throughout Georgia, through all the teachers, about what health IT is. And not only what is it, but just what you guys are talking about, what kind of jobs are out there? Because you go into a classroom and you say health IT and they say an MRI machine.
Yep.
They really don't know. So Mark is going to be participating with the DOE and with teachers throughout Georgia and with some of the others of you who want to be part of listening to that workshop the latter part of March. And Mark, if you have anything to say about what you're going to be talking about, this is a good time to say it.
No, I think we're going to be talking about the changing workforce and how this is truly a great opportunity for students to think about whether it be very simple roles, entry level roles, all the way to very sophisticated ones, and they could truly grow a great career. And frankly, Georgia can actually create a wealth of talent, which we could look at very competitively, not only in our own state, but also nationally.
I agree. One thing I'll just throw in there really quickly, an example of what really worked. FinTech, as you know, we're called transactionality. 70% of every credit card transaction comes through an Atlanta company. What we did with FinTech Atlanta was simply go to the employers and said, employers, what do you need? And it was a lot different than what we thought they needed. And it was certainly a lot different than what the academics thought they needed. And so the success of what Pat was talking about, going to that Lieutenant Governor meeting was really eye-opening because we brought the corporate executives there with the legislators. And then what we can do is create really a health IT academy, something that's really, really successful, just like we've done on many others. And Pat, with your leadership, and Mark, with your background, and everyone on this screen and on the chats who I've been with for many, many years, I think we can do this. I think now's the time to do it. And I really do believe that, TAG is in the position to pull this together with all of the partners and members that you have. So we got 3 more minutes. Is there anybody that has a question? I'm seeing a lot in the chat, but some of these are going to be very difficult to answer in the next 3 minutes. But it is about kids. Just about everyone I'm getting is, look, tell them what Health IT is, because they didn't know what FinTech was. Now it's almost an impacted program, by the way. So the corporations created the curriculum. It wasn't the educator, which was really interesting. And the educator said, we can teach that, and so they're getting the jobs as a direct result of what they asked for. So,
yeah, David, I just want to, chime in real quick with that. And I talked about this early on in our first question, having that partnership. So one of the things that schools can do, just like Morehouse School of Medicine, we have a health IT or external advisory committee. In fact, Chris serves as the chair of that our health IT advisory committee, because again, understanding what industry needs and wants are, pairing them with what the educators offer creates these programs, and then move to make sure that students are getting the training that our industry says, our industry partners say that needed for them to go into the workspace.
That's excellent. I'm going to go ahead and halt it here. And I just want to thank each of the panelists and those who helped us prep. This is fabulous. I thoroughly enjoyed the conversation, and I think it's the beginning of many. And it may not be on a Zoom format, but it definitely can be this community coming together. And with that, I'm going to turn it back over to you, Brian.
David, thanks so very much. Again, I want to reinforce, very appreciative to today's panel, Steve, Dr. Howard, Marc, Damien, for joining us and being able to weigh in on this very important topic. There will be more conversation about this. Absolutely, David. Thank you very much for helping moderate and lead this conversation. We will continue, obviously, into the TAG Summit coming in at the end of next month. So please tune in for that as well. There's more discussion around this topic. So thank you very much for the panelists again. Thank you, David. And looking forward to future discussions.
Thanks.
Great. Thank you all. Have a wonderful day.
Have a great day. Thank you. Bye-bye.
Thank you.
Great job, guys.